Hey, welcome back to the Health with Hashimoto's podcast. My name is Esther, and I'm going to tell you a little pet peeve of mine, and it's not directed at a person as much as an industry. So this is my pet peeve. When people tell me, oh yeah, I take levothyroxine or Synthroid, but it's just what I do. My doctor told me that I'll always be on it. My thyroid doesn't work well, and then that's like the end. Well, no. So I usually ask them, do you know why? Do you know why your thyroid doesn't work? Or I'll ask, do you have Hashimoto's? And they're like, well, I don't know. My doctor just said I should take some Synthroid. Like, case closed. And that is my pet peeve. My pet peeve is that doctors are not equipping patients to know what's going on in their body. They're saying, here is a problem. Here is a drug that's just going to supplement what the problem is causing. It's kind of confusing. The problem is causing problems. Your thyroid is not producing enough hormone. So we're going to give you a medication to give you more hormone. But they never address why the problem is there in the first place. How many people are on Synthroid? I told you the other day, 2 weeks ago, when we were talking about Synthroid and levothyroxine, that there are over 82 million prescriptions every year in the United States. That's not even, worldwide. That is just in the United States. That's levothyroxine. So it could be Synthroid. It could be any of the generic levothyroxines. 82 million. That does not mean that 82 million people are on it. That means the number of prescriptions. There are an estimated 18.1 million patients on it in the US. So over 18 million people just in the United States have their thyroid not working well. That is a lot of people. And just based on my personal interactions with people, there are a lot of them who don't know why they are on it, and they don't know that there are things to do. And this is most concerning for me because if the hypothyroid, which they're treating with levothyroxine or Synthroid, if that is caused by Hashimoto's, which is an autoimmune condition, the chances that they will develop other autoimmune conditions is very, very high. So by telling somebody, here's your medication, come back in 2 months, 3 months, whatever, we'll recheck your labs, we'll update your prescription and repeat that cycle for life, by telling them that that is the answer instead of saying, hey, let's check your blood work. Let's see if you have antibodies. Let's see if your body, if your immune system is attacking yourself. By leaving that out, they are also putting their patients at a huge disadvantage. Instead of running those labs and saying, oh my goodness, you have some antibodies, that means your immune system is a little haywire, and let's figure out what we can do to calm down your immune system so that it can function properly. Instead of doing that, they're ignoring it completely, just not even acknowledging that it might be an issue. And then the immune system continues to go haywire. And an out-of-whack immune system that is attacking parts of your own body will eventually progress to other parts of your body. As you've heard me say on this podcast before, autoimmune conditions are named for usually what part of the body your immune system is attacking. So Hashimoto's, your immune system is attacking your thyroid. Graves' disease, again, your immune system is attacking your thyroid, but it has an opposite effect. Instead of hypothyroid, you have hyperthyroid. 2 different autoimmune conditions. There are a lot of different autoimmune conditions. Let me give you a couple. Rheumatoid arthritis is fairly common, and that is your body attacking your joints. You get inflammation in your joints, you get a lot of pain. Type 1 diabetes typically is in kids, and that is diabetes because of your body attacking your pancreatic beta cells. Graves' disease, I already talked about. Lupus is an autoimmune condition, and in that one, you can have attacks on so many different things: skin, joints, kidneys, heart, lungs, brain. So much can be under attack in lupus. Multiple sclerosis has been labeled an autoimmune disease, and that is when the myelin sheath, it's the protective covering of the nerves in the brain, that's attacked. Psoriasis is a skin condition, and that is an autoimmune thing. And then there's also psoriatic arthritis, which is related, and that's when your joints are under attack. Inflammatory bowel disease, or IBD, when your gastrointestinal tract is under attack. And that can include a lot of different subsets, like Crohn's disease or ulcerative colitis. Those are types of inflammatory bowel disease. There are a lot of different autoimmune conditions, and we don't want more. When you have one, that's enough. We do not want more. And research tells us that when you have one, you are more likely to get more. And that's because your immune system is the culprit. It's not your thyroid. That's not the problem when you have Hashimoto's. Yes, your thyroid is not working well, but the problem is that it's under attack. So we need to solve it at the root. And that is why I get so annoyed when people tell me, oh yeah, I'm on Synthroid. I've been on it for like 30 years and it's okay. I just go in and fill my prescription. But what else is there? What are they not seeing? And what other health conditions are they experiencing that's going to take, 4 years to diagnose? In Hashimoto's, it takes about 4 years and 4 specialists before people get a diagnosis. And that's after starting looking for the answers. They're having symptoms before that. 4 years on average. And most of those people experience at least one misdiagnosis in that time. Other autoimmune conditions are similar. It's several years on average before they're diagnosed. Lots of lab testing, lots of doctor's visits, lots of, your labs look okay, you're fine. And meanwhile, the person is saying, I'm not fine. That's why I'm here. I'm here because I don't feel well. I'm here because I know there's something going on in my body. And the doctor is like, well, your labs are fine. Come back in a little while. No, that's not the right answer. And giving somebody a lifetime prescription for Synthroid without digging deeper is doing such a disservice to that person. So if that is your story, I am sorry that has happened to you. I'm sorry that the medical community has dropped the ball so much on this. And maybe it's not just dropping the ball, maybe it's just they haven't picked the ball up. So levothyroxine itself was synthesized, so they figured out how to make it in a lab back in the 1920s. It became commercially available in the 1950s. So we have been prescribing it for a very long time. And in that time, medical research has figured out, this is usually an autoimmune condition, and then figured out what autoimmune conditions are and some root causes. So maybe it's not that they dropped the ball, that they didn't say, this is an autoimmune condition, but we're not going to look any deeper. It's maybe instead that the doctor doesn't know. Or if they know, or if they've been taught, then that habit of saying, your TSH is high, so obviously you get some Synthroid, that habit of seeing TSH and prescribing Synthroid and not going deeper, maybe that is what's going on. And it's a bad habit. And I really get frustrated for people who are harmed by this bad habit. And this is not just general practitioners. This is endocrinologists. Endocrinologists who should be on top of the latest research. And I get it. Doctors are busy. The insurance companies require them to see so many patients. They just treat people, their doctors, their specialists as factories. Insurance companies, there's so much wrong with them. But treating a doctor or a specialist is a doctor. Treating a doctor like a factory and treating the people who go in and out of that office like widgets is so bad, so bad. It harms the physicians. It harms the staff. It harms the patients. And by harm, I don't mean physical damage, although in the patients, yes, if you develop more and more autoimmune conditions, that is physical damage. But for the practitioners, it's so depressing. Going into a field to help people, having this desire to make a difference in the world and to change people's lives, and then to be treated as a cog in a factory by the insurance companies, that is so demoralizing. And people get burned out and they get depressed. And then that has led to an epidemic of suicide in physicians. Physicians and farmers, they The incidence of suicide is going up, and it breaks my heart because everybody should know that they are valuable. Everybody should know that they are loved. Everybody should know that there is hope. But if you're in this system, the insurance company and your clinic are treating you like just a cog in the factory, like they're taking away your hope. They're taking away your agency. They're taking away your mission in life to help people. And then the people who are coming through, they're being treated like widgets in a factory, and then it is hurting them because they're not getting the answers. They're not seeing, oh my goodness, it's actually my immune system that's going haywire. And that's why I have Synthroid. That's why my thyroid isn't working well. So what can I do to address that? And maybe the endocrinologist doesn't have the answers. I have heard that a lot of them don't. They're just like, I don't know. You have Hashimoto's. Okay, I don't know what to do for that. Take some Synthroid. But even if they don't know, if they give their patients that name, Hashimoto's, then the patient can go out and they can, open up their favorite podcast app and they can search Hashimoto's and this podcast will pop up. Maybe that person is already in some communities on school.com. So they type in Hashimoto's and the Health with Hashimoto's community is going to pop up. Maybe they're on Facebook and they type in Hashimoto's. I don't have a Facebook group, but I know that there are other Hashimoto's groups on Facebook. So maybe the endocrinologist doesn't have the answers. Maybe the family physician doesn't have the answers, but they can give their patients the names. Instead of saying, your thyroid is not producing enough thyroid hormone, so you're going to be on Synthroid for the rest of your life, period. Instead of saying that, they could say, your thyroid isn't working well. Let's do some labs. Labs come back. Your thyroid isn't working well, and that's because you have some antibodies that are elevated. This means you have Hashimoto's. I don't know what you want to do for the Hashimoto's, but I know that I can give you Synthroid to address the fact that your thyroid is not producing enough hormone. And then that patient can leave that clinic visit, maybe a little frustrated, they didn't get answers, but also empowered to say, okay, I know that there's a problem with my immune system. The doctor said this was an autoimmune problem, and I know the name of it, Hashimoto's. Now I can go do research. We have the entire world at the tip of our fingers. The internet is amazing. You can find out so much. And now we have AI. I have mixed feelings about AI. I don't know how you feel about AI. I absolutely love AI for my podcast. I do my own podcast. Like, you are hearing this from me, my ideas. Sometimes I will throw in a whole bunch of my ideas into like ChatGPT and say, put this in an outline format for me because my thoughts are all scattered. But usually how I use AI is I will pull the transcript from my podcast and I will put that in and say, please help me figure out some reels or some Instagram posts or a Pinterest or something from this, because I've already done the work of recording the podcast. Like, taking something that you've already done the mental work for and then putting it into AI to help you put it into other formats, I think that that's a great use of AI. Using AI as a Google search or as a Wikipedia, that's a little scary. So I do know that it happens. People go to AI and they will say, tell me about Hashimoto's. And AI might give you some good information and they might give you some false information and you don't know. So I would encourage you, do not use AI for a search engine. Use it to help in other ways. Like a menu. Have I told you this before? One of the people in our school community, Health with Hashimoto's, I was having a one-on-one call with her, and she was telling about the problems they have figuring out meals that everybody in the family, will eat and can eat. So for that, we went over to ChatGPT and we said, give me a menu that is for 4 people. It has these dietary restrictions. Keep it at under X amount of dollars per meal. And boom, there was a menu. Like, that's fine. That's a great use of ChatGPT or other AI. But asking for information about medical stuff, probably I would turn to experts instead. I'm not just saying that because I am an expert. I'm saying it because I have asked it some stuff just to test it, and it has spit out some false information. So I've tested it. It's bad. Don't do that. Okay, what was I saying? Okay, you leave the doctor's office empowered because now you can do your own research. So my challenge today, I don't usually give you challenges. I usually give you tips. I usually give you solutions. But my challenge today is if you know of anybody else who is on Synthroid or Levothyroxine or any thyroid medication, ask them why. Ask them if they've had their antibody levels checked. And the reason that you're asking is to help them figure out that they might have more that they can do for their health, and they might need to protect themselves from developing other autoimmune conditions. And helping people prevent another autoimmune condition is being such a caring friend. So you can share this episode with them. You can share the podcast with them. In fact, if you have not left a rating and review before, I would love it if you spend a couple minutes giving a rating or review, because that really does tell the podcast apps that this is a podcast worth listening to. I have a lot of people who listen every week and not a ton of ratings and reviews, so it would just help. It would help get the word out. But I challenge you to ask your friends, if you know they're taking Synthroid, ask them if they've ever had their antibody levels checked. Ask them if they've ever had their reverse T3 checked. Those are the two different things, antibodies and reverse T3, that I find people are not checking, people being the specialists. And that's after talking with people, not with the providers. I'm talking with the actual patients. So the reason why you would want to check those two things, antibodies, is because those can start to elevate 12 to 15 years before there's enough damage done to your thyroid to cause it to not work well enough. So you really want to know your antibody levels. And then your reverse T3 is, you want to know that because you want to know if your body is able to convert the T4, which is what your thyroid produces, or it's what the Synthroid or Levothyroxine is, that's all T4, and your body is supposed to convert that to T3, which is the active form that it can use. But if your body wants to prioritize rest and healing, then your body will convert some of it to reverse T3. So I always want to know how much your body is converting to reverse T3. I feel like that is an important part of the big picture. The whole picture is not just, is your thyroid producing enough hormone, or is your brain asking for more thyroid hormone, and that's your TSH, your brain asking. I want to know your TSH. I also want to know how much T4, thyroid hormone, is circulating in your body. And I also want to know, are you converting it to the rest, the brake system, the reverse T3, saying, no, let's prioritize rest and healing. I want to know all those. I want to know the antibodies. And I feel like it's so important for patients who are on Synthroid, the 18 million patients on Synthroid just in the US. I feel like it's so important that they know what's going on in their own body. They deserve to know. They deserve to have the ability, the autonomy to say, I want to take more control of my health. I want to be able to look ahead and say I'm at risk for autoimmune conditions and I want to prevent them. And you can do that, but only if you know about it. And that is why people who are just on Synthroid but don't know their antibodies, they don't know their T3 or their reverse T3, that is why it is a pet peeve of mine, because they don't know that there's more that they could be doing to prevent further problems down the road. And quite honestly, I feel like it's medical malpractice to not let patients know about that. I feel like doctors, providers, they have a responsibility to give their patients the information that their patients need and help them figure out what to do with it. And our healthcare system is broken. The doctors don't have all the information. The doctors don't have enough time to do all of that, but they can point you into the right direction. Or they can say, you can look at this online and you can figure things out. I'm just giving you the data. It's hard to say that. As somebody who went back to school, I went to school for 4 years to become a nurse. And then I went back to school for another year. Was it a year or 2 years? I don't even remember. To become a holistic health educator and nurse coach. I went back to school. It's hard to say after all of that schooling, I don't know. But I don't think anybody expects one person to have all of the answers. What we do expect is people to be truthful. And we expect our providers to say, here's the information I know, here's what I can do for you, and now it's your turn to go and dig into more and to change your health. So I encourage you, talk to your friends. Refer them to this podcast, refer them to our community, help them take their own health into their own hands to make a better future. This podcast is for informational and educational purposes only. Please discuss any concerns and plans with your trusted healthcare professional. If you found this episode helpful, will you please share it with a friend? I'll see you next week on the Health with Hashimoto's podcast.